Are live. Hello, everyone. Welcome, welcome, welcome. Very exciting. Okay, perfect.
Hi.
Hi, how are you?
I'm good. How are
This
you
is
doing?
great. I feel like I
Yes.
need more volume. Okay. Let's do more volume. Hello, everyone. Welcome. Come on in. Awesome. Very good. This is exciting. How are you doing?
I'm doing good. How are you doing?
Good, good. So we're gonna go ahead and get started. Go ahead and
Mhm.
introduce yourself and let us know
Okay.
about yourself.
Awesome. Hi, everybody. My name is Kiana or Dr. Key. I go by Dr. Key. I'm a licensed physical therapist who have been treating more than a decade in the physical therapy realm, especially more outpatient activities in clinics. And I love treating patients with chronic pain. I am a fellow chronic pain patient myself, so I understand how people um,
Yeah,
go through the experience. And so that's why I'm very passionate about that. And yeah, my business is bmoremobile PT, and I'm a mobile business. So I actually go to my patients.
nice.
So whether you're at home, at work, or anywhere you want me to come, I'll essentially come to you. So
That is
yeah.
awesome. So tell us about kind of your journey into physical therapy.
So I would say it started with a faith journey because I'm originally from Iran. So I came to US years ago to be a dentist,
Wow.
and the Lord had a different plan. And so one of the reasons that I think really led me to physical therapy was it provides an opportunity for me to be able to share the gospel and be able to start with the beginning of people with their journey of healing and walk with them from day one to the day that they graduate. And it is something that is so extraordinary to help people to get to the place they want to get with that healing journey and make a difference in them. So so yeah, I love people. That's for sure.
That's
I think
awesome.
that's one of the and human anatomy and physiology is like very fascinating of like
Yeah.
how the human body works. So so yeah, it's been an exciting journey, you know?
Yeah. No, that's awesome. I mean, I think like one thing that I encourage my patients with a lot is, I'll have patients who come to me and they'll say,
Hmm.
physical therapy didn't work. And so usually
Hmm.
my first question is, where did they do physical therapy? Because I know
Hmm.
that every place doesn't kind of go about things the same way. There's some
Hmm.
places where you come. My first encounter with physical therapy was actually in college. I dislocated my shoulder.
Ooh, okay.
And so, it was kind of like a place where I went, they kind of just gave
Hmm.
me a packet of exercises. I kind
Hmm.
of tried to do them
Very
myself. And
generic,
then,
yeah.
and then
Hmm.
I got some stim at the end, and then that was kind of it. I was sent on my way.
Hmm.
And so that's really the first thing that I ask patients is
Hmm.
where did you go?
Hmm.
And then after that, kind of trying to get an understanding of, okay, what was that experience like? Were they working one on one with someone or were they not? Because that can
Hmm.
really make a big difference.
Hmm.
So what do you typically say to patients who might have,
Hmm.
encountered physical therapy before when
Hmm.
they come to work with you? They might be discouraged from the previous
Hmm.
experiences they had. What makes kind of your approach to patient care different or maybe additive on someone's journey to becoming, well?
Yes. So I would say I think it's very important to treat the person as a holistic and not the actual symptoms. The symptoms are important. That's why the patients come there. But
Right.
especially if I've had patients that have been to different places and many different places and they're discouraged, they have tried
Yeah.
different things. So we go through like, what have you actually tried? And what is the underlying issue that is causing you to have these symptoms and repetitive symptoms? Because I'm here to treat you. So if I can
Right.
treat your symptoms, but if you don't treat the cause, guess what? You're going to keep coming back. And
Right.
that's not one ethical. Two, you're going to be discouraged again at the end of the day, you know?
Right.
So I would say, especially when it comes to pain, education is very important. Like a lot of patients don't understand what is pain. What actually happens in your brain when
Right.
there's a pain signal? Like that whole
Right.
pain neuroscience
Yep.
education, like that is
Yep.
one of my favorite topics to talk to
Yeah.
patients about, because once you understand that, you get to actually address different things in your own body,
Right.
understand your own body better,
Right.
and that research proven that actually helps a lot with regulating your nervous system, with
Absolutely.
regulating your pain. Um,
Absolutely.
so yeah, so we go through like holistic of like how is your lifestyle, how is your sleep, how is your nutrition, what are your daily activity, how's your movement pattern, how's your
Yeah.
posture, how's your ergonomics. Like a
Yeah.
lot of times if you haven't had a surgery or actual injury, like a car accident or something, a lot of times it's repetitive activities and improper posture and
Yeah.
ergonomics that over time leads to issues. And then we go through the treatments, like what are the treatments you have tried, how did it work, were you a good patient? Did you actually do the exercises or the activities? And essentially create an actual program that is curated for you,
Hmm.
that works with your schedule, with your lifestyle, and it's a trial and error, like getting to know the patient and going through the process. And I tell people physical therapy is not a quick fix,
Right.
oftentimes, especially with chronic pain. And in this world that we see everything is so quick and you want
Right.
everything a quick fix, healing takes time. Like our
Yeah.
bodies are actually designed to naturally heal itself, but like it takes time. It has to
Yeah.
go through a process and you have
Right.
to be an active participant in that. So yeah, so we go through different techniques and methods. We can talk through that if you want, but everybody's different and it shouldn't be a generic thing. And I'm not a huge fan of passive modalities, to be honest. Like when we talk about e-stim and stuff, like e-stim can be beneficial if you're having like acute symptoms initially, but
Yeah.
like my goal is to get you to a point that you can get independent with your
Hmm.
symptoms and with your
Hmm.
pain and how we can address it so you don't have to keep coming back to me.
Yeah.
And so yeah.
No, that's great. I'm just putting something, so as people are joining, welcome in, and please drop your questions. We'll be addressing
Mhm,
them. This is a live Q&A.
mhm,
So definitely want you guys to get to know Dr. Kiana. But this is an opportunity for you to ask us any questions that you have as it pertains to physical therapy or
mhm,
interventional pain. So we're happy to ask them. Just feel free to drop them in the chat box here, and I will be
mhm,
monitoring those. So one thing that you said that I think is super important. So education 100%. I think that's a
mhm,
big part of my practice as well, is really,
mhm,
allowing patients to get an understanding of what's going on in their bodies.
mhm,
And like you said, allowing people to understand that connection between the brain and the body.
mhm,
And it's such a significant thing that I think
mhm,
there's sometimes people, it's not saying that it's all in your head, but it's actually
mhm.
highlighting the component that the brain and the central nervous system actually does play in our pain processing
Yes.
and everything like that. One thing that you shared was the fact that you know you, that education piece and allowing patients to understand things. So one of the really
Mhm,
significant experiences I had with one of my physical therapists, I've been in and out of physical therapy essentially since 2014.
mhm.
So I've been kind of on this journey with different physical therapists that I
Mhm.
actually absolutely love.
Oh,
And
good.
so my physical therapist in residency was incredible.
Mm,
Kenzie Balak, we should be doing a live together soon. She's
mhm,
amazing.
mhm,
And I was just having all these issues. I talk about tech
mhm,
neck a lot on my
mhm.
platforms and things, because that's something that I've dealt with, that I continue to deal with. There's
Yep.
some devices I've been using to help me with adjusting things
Mhm,
and optimizing my ergonomics, but just tension
mhm,
is just an issue that I've kind of recurrently had. And I
mhm.
remember we were working on things once, and she's like, sometimes like it's not that the muscles need like more relaxation, like you just
Mhm.
need to get stronger sometimes. And that just
Yep.
totally like flipped a switch for me. I was like,
Yeah.
you know what, because I'm very weak and I really need to work on this stuff. And it's something, again, I've been on this journey,
Yeah.
right, for like over
Mhm,
10 years and everything like that. And that, like, her providing that education to me
mhm,
flipped such a switch, and I was like,
mhm,
my priority became, all right, I need to work on building my
mhm.
strength.
Yep.
So that really highlights the importance of
Mhm,
education. Again, this idea of a multidisciplinary team,
mhm,
we it's not about doing things alone. It's about
mhm,
having a team of specialists who bring something different to your care,
mhm,
that can provide different insight and that can work together to
mhm.
help you feel better. So we have some questions coming in here from the audience.
Yeah. Absolutely.
Don't call me Dre. Hello, good evening, welcome.
Hi, everybody.
Yeah, what qualifies pain as chronic? So that's a great question.
That's a great question.
Yeah, so by definition, chronic pain is essentially when pain is lasted for more than 3 months.
Three
So
months
that's
up.
really kind of the timing of it. So
Mm-hmm.
before that, it's something that we can consider to be acute pain. So once it
Mm-hmm.
crosses that threshold of 3 months is when we
Mm-hmm.
consider pain to be chronic. Does that
Mm-hmm.
answer your question there? You can just give me a thumbs up or a heart, and if you have a follow-up, I'm happy to answer it. How do you know when you should see a physical therapist? So I will start this one, and then I'll swing it back to Dr. Key. So
Sure.
how do you know when you should see physical therapy? Honestly, my recommendation to patients and what I've done myself is,
Mm-hmm.
if you are hurting, right? If you're hurting anywhere, or even if you've identified, for example, that there's certain movements that you make and your body's aching and all these different types of things,
Mm-hmm.
you can see a physical therapist. Because what I tell my
Mm-hmm.
patients, even the ones who come to me with gym injuries, the ones who come to me
Mm-hmm.
with herniated disc and all these things, who are gym rats, right? Like they work
Mm-hmm.
out, they lift weights, they do all these things. It's not that you can't work out and it's just about the exercise. It's also about that biomechanical evaluation. And what I
Mm-hmm.
explain is that sometimes there are micro weaknesses that you have that you can't
Mm-hmm.
identify, or things that you've been compensating for years. And a
Mm-hmm.
physical therapist evaluation is what is capable of unearthing those things and really identifying
Mm-hmm.
these things, and allow you to work on even those micro weaknesses, these little things that,
Mm-hmm.
yeah, you may be buff, you may be huge and swollen, bulk and
Mm-hmm.
everything, but you may have these micro weaknesses that you're compensating for. So I
Mm-hmm.
honestly think that everyone should see a physical therapist at least one. Honestly, like
I
that's
agree.
really honestly my perspective, is what I think. What do you think?
Yeah, I would say I agree. And if this helps you guys, like I'm a PT and I also give physical therapy myself. That's how
Yeah.
much I believe in physical therapy because, as you said, like even going back to the question about the chronic pain, a
Yeah.
lot of patients, and I would say patients around our age too,
Sure.
high busy professional,
Yeah.
high functioning, professionals that they have the pain, but they don't address it in that acute phase. And then they wait and they wait and they wait and it becomes a chronic thing.
Right.
So I tell people like if movement should not be painful. Like if
Right.
you are going to the gym, if you're lifting, you shouldn't be having soreness is different, but you're
Sure.
actually having
Right.
pain, you shouldn't
Right.
be experiencing that. So that's definitely, I would say, get it checked out. It may be, and also going back to the education piece, like it could be something also going on in your brain too that is
Mhm.
signaling more than what is actually going on at the tissue level.
Right.
And just that, calm like evaluation of like, no, I'm actually doing better than I think. I just need to tweak certain things and I'll be
Right.
fine. That will make a huge difference even moving forward with your confidence of like, okay, I can do this movement or I cannot do this
Right.
movement. And my other thing that I would say is prevention. I'm a huge fan of preventative care.
Yep.
So a lot of times, as you said, like with lifting, with ergonomics, like posture,
Yep.
what is your daily, we're creatures of habit. What
Yep.
are your daily habits that is leading you to have a pain-free lifestyle or a painful lifestyle? How is your stress level? There's a lot
Yep.
of stress has research proven, and I can
Yeah.
say like my chronic neck pain is a stress is a factor, is a
Right.
huge triggering
Right.
factor,
Right.
and we don't take that lightly. What are the
Right.
things that are like can be a contributing factor that you can get addressed before it gets to that point that you're in so much pain that you can't move,
Yep.
essentially? So anybody at any time can go see a PT, even to just
Yeah.
get it checked out.
Exactly. I totally agree. Desi Doc, thanks for being here tonight. When patients come in requesting cultural or homeopathic remedies for pain, what kind of discussion or research do you utilize to talk to them? So, in my practice for cultural remedies or homeopathic remedies, I'm really in support of a holistic approach to pain. So,
Hmm.
typically, and really my philosophy as well is, if there's something that someone has used, whether
Hmm.
or not the research shows that it helps, if I don't
Hmm.
think it's a danger to them, I'm going to
Hmm.
support it. Because
Hmm.
if there's something that is helping you, even if it's a little bit, then
Hmm.
I'm going to support your use of that. And again, if it's not harmful to you, I'm going to support your use of that so that you can improve your quality of life. So I would say
Hmm.
that's the first thing, honestly. And so I do engage in that discussion, because sometimes people will come, they'll say, hey doc, I've been using this cream, I've been using
Hmm.
this compound. Hey, I have a lot of Asian patients who'll tell me, hey, I'm
Hmm.
using this, like, cream from my country and things like that.
Hmm.
And I'm like, okay, is it helping? Yeah, great, perfect, definitely keep it up, And
Yeah.
so that's the first thing. And so just having an understanding if it's helping them or not. And then
Hmm.
research. So usually if it's a question to me, right, like, oh,
Mm-hmm.
do you think that this is something that would be helpful, and it may be
Mm-hmm.
something homeopathic that I don't have immediate exposure to, then I will do that research, and
Mm-hmm.
I will provide them with information, whether it
Mm-hmm.
be during that clinic visit or if it's in a follow-up. And then the third thing I will say is, because I do have that interest in kind of a holistic approach, I also
Mm-hmm.
do a lot of my own personal research on the data
Mm-hmm.
behind different non-traditional, things that people can use to help with their pain. So
Sure.
Desi Doc, I hope that that answers your question. Feel free to drop a heart or a thumbs up if it did. Dr. Sarno, thank you so much for being here tonight. I hope you're having fun with the kiddos. Yeah, so any other questions for us? Any other questions? Feel free to drop your questions below. So, Dr. Kiana, something else I'd
Mm-hmm.
love for you to share with everyone is,
Mm-hmm.
I know that one thing that's unique to your practice is that you do also do dry needling. So dry
Yes.
needling, yeah, dry needling. Listen, I've had dry needling. I prescribe dry needling.
Mm-hmm.
Obviously, I do trigger point injections in it as an
Mm-hmm.
interventional pain physician, and I think it has its role. But I also think
Mm-hmm.
that dry needling has its role.
Mm-hmm.
And so I'd love for you to speak to us a little bit about
Mm-hmm.
dry needling and kind of what you've seen that do for your patients.
Absolutely. So if you know me, you know I'm a huge fan of dry needling. I call
Yes.
it my magic pill because it really works, especially with my patients who do have chronic pain.
Yeah.
So essentially dry needling, we use the same needles as acupuncture, but the technique, the philosophy, the
Sure.
science behind it is very different.
Right.
So we go deep in the muscle belly over the trigger point. So what is a trigger point? If you touch even your upper traps, you feel that muscle
Listen.
knot that is really tight. So
I need
yes.
some I need some dry needling right about
Yes.
now. All
So
right.
anything that is like over the time is essentially overused. If you loaded, stress it over time, it becomes hyper irritable. If
Yeah.
the muscle fibers get out of alignment, and then you start getting symptoms, and it starts building up things in that hyper irritable muscle knot that is not helping. That's where the pain is coming to. So with dry needling, it's a quick treatment too. So if a lot of people don't have experience with it, they compare it to acupuncture. Like acupuncture, you go like superficial and you keep the needle in. With dry needling, we don't do that. We go deep in the muscle belly. We target specifically that trigger point, which we can experience it as a clinician with palpation and
Yep.
movements, and the patient, talking back to us about that too. And it's like I would say a 10-15 second treatment. You go in and out, and you will instantly, and I'm not exaggerating, you will instantly get the release that you've been looking for. So let's say, especially with people that have been pain for a long time, they go get massages.
Yeah.
It helps temporarily, but the pain keeps coming back. That is something that the dry needling really does make a difference, because going back to that pain science is essentially we're disrupting your nervous system. The
Mhm.
nervous system that has been hyper irritable, hypersensitive, that is giving you so many signals that it's not supposed to, is like the alarm system up here. We're regulating that system by
Yeah.
disrupting it, and bringing it back to the way it should go with the correct movement pattern that we can then reteach it. So you can see an instant change with your pain. You can see instant change with your range of motion. I've had patients that in my clinic that literally cried
Hmm.
afterwards because they've been in so much pain and they couldn't move, and they get the change right away, and they're
Yep.
like, this is a miracle. Like, this is
Yeah.
magic.
I've
I'm
had
just
the
like, it
same experience
really
with
is.
trigger points. I mean, they're very emotional. Like, I've had patients weep
Yeah.
after trigger point
Yeah.
injections. So trigger point injections, no, I love that. I think that, dry needling is such a wonderful modality. And so you being
Mm-hmm.
certified in dry needling, I think is really
Mm-hmm.
an amazing thing. And if you guys aren't following Dr. Kiana, please be sure to follow her. Be more mobile PT.
PT.
So be
Yes.
sure to give her a follow. Check her out. If you have any PT needs, be sure to get on her schedule because she is what's up.
Mm-hmm.
Desi Doc, how does insurance coverage work for patients with chronic pain? Do they have to take breaks in between? So what my experience has been is it really depends on the insurance. So
Mm-hmm.
I have, again, like I said, been out of physical therapy for
Mm-hmm.
over 10 years. And so I have not had a point necessarily where my insurance stopped covering my physical therapy, but
Mm-hmm.
sometimes you may need a new order from the
Mm-hmm.
prescribing physician or something like that.
We
But
can
some
justify
insurance
it.
plans are very
Mhm.
difficult to deal with.
Mhm.
So that is
Mhm.
why what's beautiful is a lot of physical therapy practitioners now are able to offer you services outside of your insurance. So
Mhm.
so that's the benefit of working with people who also have payment models where you don't necessarily
Mhm.
have to use insurance, because
Mhm.
you can get to the point, honestly, where it's like you still want to be you want to make progress, right? It's something
Mhm.
maybe that maintains you and that helps
Mhm.
you to kind of maintain that function, and it's not something that you want to
Mhm.
discontinue, right? And so that gives you the opportunity to continue working closely with your physical therapist.
Mhm.
So that's just something to remember. But it's really very insurance dependent. Like I said, I've had the experience where I haven't had to interrupt physical therapy for that reason.
Mhm.
I've also had the experience as the physician where, you know,
Mhm.
someone's insurance was asking me to either recertify or, you know, write a letter of necessity or place just simply a new order so that
Mhm.
they can continue being seen by their physical therapist. Don't call me Dre. How do we find a healthy sleeping position? My mornings have been painful. So I actually have a video, several
Mhm.
videos on this. If you go in my highlights under the lifestyle tip, you will find the video about sleeping positions. And there's more about that coming from me shortly. So be
Mhm.
sure to follow along for that. But I guess what I can ask you, since you're asking the question, are you a stomach sleeper? Are you a back sleeper? Or do you sleep on your
Mhm.
side? Let's start with that so that we can make our
Yes.
response unique
And I
to
would
your
say with
situation.
sleeping, that's a great question because a lot of people, we don't think about sleeping like throughout the rest of the day. But if you actually think about it, if you are, hopefully you are having 6 to 7 to 8 hours of sleep every night, hopefully, right? And let's say if you are having that, imagine being in the same position, sitting in the same chair for 6 to 7 to 8 hours.
Right,
You can't tolerate it if the
right.
chair is not properly ergonomically set up for you. So
That's
we
right.
don't think about sleep like that. And sleep is where the area that your body is actually healing itself, is
Right,
actually resting, is actually rejuvenating itself. And so if you don't get a good night's sleep, that definitely does not help with the nervous system. That spike up everything, which then brings this whole cycle of the chronic pain back again. So
yep,
I would say proper ergonomics, proper pillow. I have spent money on my pillow and I
yep.
carry that pillow everywhere I go when I travel.
I hear you.
Just,
Listen,
I tell you,
it's been a
recently
journey.
traveled. I was traveling with little suitcase that I couldn't
Right.
take my big pillow. And girl, my neck flared up. So I had to get a pillow. One of my friends over there had to give me a new pillow with ergonomic. So it like
Yeah.
makes a huge difference, like
Yeah.
have having proper positioning as well too. So she said all the positions I toss and turn. I'm not a huge stomach sleeper fan.
Yeah, I definitely listen. We don't recommend stomach sleeping. Okay, let's just get
Yeah,
that out. Let's get that
yeah,
out the
for
way.
low back and neck.
We don't recommend stomach sleeping. Again,
Hmm.
listen. We're talking about musculoskeletal complaints.
Hmm.
So I'm not talking about obstructive sleep apnea. I'm not talking
Hmm.
about pulmonary disease, right?
Yes.
I'm not talking about that. But for musculoskeletal things, sleeping on the stomach is just not ideal for a number of reasons. And again, I went into quite a bit of detail in the lifestyle tips for you guys. So I don't recommend that. Neither does
Hmm.
Dr. Key. Okay.
Hmm. Hmm.
If you're gonna sleep on your back, then you want to make sure that you have a pillow under the knees. That's gonna help
Hmm.
to relieve some of the pressure on your spine throughout the night.
Hmm. Yep.
And if you're a side sleeper, you want to, something I learned from my physical therapist is to actually put a little support. So some people will roll a little towel, or
Yep.
sometimes I've used kind of just like one of those pillows that are so flat already,
Hmm.
and I'll actually just put it in the crevice here on the side, you know, like kind of
Hmm.
like between your rib cage and your hip area. And that
Hmm.
provides an additional layer of support. And then you want to, again, have that pillow between the knees if you're a
Yep.
side sleeper.
Yep.
For patients who do have issues with their shoulders, a lot of times I'll recommend sleeping with a pillow that kind of just supports the arm a little bit. That can be very
Yes.
helpful.
Hmm.
So those are just some quick tips, and be sure to do a deep dive because I think those videos are really helpful to kind of walk you through
Yes.
what you are going to need and some images and everything like that. So it'll be good.
And just remember, pillows are also similar to mattresses. You got to break
Mm-hmm.
them in. So like a lot of times if you get a pillow, like give it some time before you can see the results. I love mine as a Tempur-Pedic pillow, and
Mm-hmm.
so it gives me enough support. And as Dr. Christelle was saying, like another way that I also like it, if you're having a flat pillow, use a towel roll and put it underneath of the crease of the neck. So when you're sleeping on that side, your crease of the neck is nice and supported.
That's so fun.
And those muscles can actually relax and
Yep.
shut down and rest so you get a good night of sleep. That
Yep.
makes a huge difference in the healing process.
A
So
100%. 100%. So
yeah.
welcome everyone. Ask us your questions below. We are here. So any kind of final thoughts here?
One thing
Um,
that I wanted to talk about,
yeah.
if you would like to chip in as well
Please.
too, is the whole concept of pain. I feel like a lot of people don't know what is actually pain when you get a pain signal. I think that education piece again, going back to, is so important. So like the layman term that I tell my patients is like pain is essentially an output signal from your brain saying, and it's a good thing. It's a
Mm-hmm.
protective thing. It's something
Right.
like, hey, something is wrong, especially if like you have an acute pain, like if you
Right.
sprained your knee or your neck or something, something is going on, we got to address it. But that doesn't directly correlate with tissue damage there.
Right.
So a lot of times people that get pain, they automatically think something is wrong, I have a tissue damage. And then when they have more pain, then that means like I have more tissue damage, but that's definitely not happening. And when we talk about chronic pain, the pain that has been going on for a few months now, the tissue might have actually been healed,
Yep.
but your nervous system now has got stuck on that signal
Right.
and is so hypersensitive. So if you have any small little movements that is actually supposed to be healing, it's sending you so many signals that is like it's overwhelming to your system. They're like,
Yep.
hey, something is wrong here, which actually nothing is wrong here. We can actually
Yep.
address that. So a lot of times with chronic pain, the goal is to regulate that and break that cycle and calm your nervous system down from having all of those symptoms back and
Yep.
forth, and it will make a significance. So a lot of people like have chronic pain, they're like, I'm not going to get healed, I've been having this for so many years. No, I just want to encourage you, there is healing here. Like
Yep.
as a fellow chronic pain patient, like you can actually experience pain-free lifestyle. You can actually do the activities, and the best remedy for chronic pain is movement. And
Mm-hmm.
but because you've been having pain, you get in this fear of avoidance cycle. You
Yep.
don't do things out of fear that is going to cause you pain, but that's actually what is going to help you to get healing. So one of the things that I love to do with my patients is going through the patterns of movement that they're afraid to do or it's painful for them, and we call them like graded
Yep.
movement patterns. And so slowly retraining your nervous system and your brain and your body that like, no, it's safe, you're
Mm-hmm.
okay, you're protected, you can do this movement.
Yep.
Or going back to the strength training that you were talking about, a lot of times the muscle that is like, let's say our upper trap,
Yep.
it's so poorly, it's taking the
It's
whole load of the
overworking.
whole family, you
Yeah.
know?
Yeah.
And then the rest of the family is being lazy, not doing anything. So like the muscle that is overused, what are the weak muscles? A lot of them
Yep.
are those deep neck cervical flexor muscles, or your posterior deltoid muscle,
Rotator.
or like,
Yep.
yeah, your rotator cuffs,
Mid
like your
trap. Yep.
mid trap, like exactly. So like the muscles that we can start loading. And that's another thing that I see patients are afraid of strength training because of the pain again. They're like,
Right.
no, we can do progressive loading in a point that your body can handle it. And it's like, no, we can go through it. We can handle it and we can progressively load it. So it it brings me so much joy when I see my patients are able to do the movements that they were not able to do before. And they're like, I
Yeah.
can actually do that again and I'm okay. Yes, you're okay. Your system is okay, you know?
Yes.
So
No, that's
yeah.
awesome. No, I totally agree. There's a lot of remodeling that happens in the nervous system that causes
Mm-hmm.
a state of hypersensitivity,
Mm-hmm.
and that essentially leads to a dysfunctional, disordered reaction to stimulus. So I
Mm-hmm.
could nerd out about that like for
I know, me
hours.
too.
So
I know.
we're gonna spare the people. Okay, so we have another question here from Dr. Akishiku. Love all the insights. Can you all share the role of different clinicians in multidisciplinary teams?
Mm-hmm. Good question.
Yeah, I think a lot of this, I've had very symbiotic relationships with physical therapists. I have
Mm-hmm.
referred people to physical therapy. I have had patients end up in my clinic who referred to me from physical therapists who said, hey,
Mm-hmm.
listen, I've seen patients of hers, she does great work, and like you should go see her to help you with what's going on.
Mm-hmm.
And so it really just depends on who sees a patient first and is helping them with something first.
Mm-hmm.
As far as a multidisciplinary team, I will say, as from the perspective of an interventional pain physician, pain specialist, and physical therapy, I can speak for us. Our job really is to diagnose, and treat within the realms of what's in our toolbox. And another
Mhm.
part of my job that I think is extremely important, and you can tell this by my notes and the way that I write them and the different, categories that I have, is
Mhm.
referrals. So,
Mhm.
I'm very, very big on sending people to the places that they need to go to have that
Mhm.
multidisciplinary team. So I'll refer
Mhm.
to physical therapy, I'll refer to pain psychology, I will
Mhm.
refer, if I have a cancer patient, I'll refer to palliative care because I
Mhm.
want to make sure that the patient gets everything that they need. I refer to surgery, right? If I
Mhm.
see there's a stenotic lesion, I'm like, listen, I think that we need to get the input of a surgeon here. I've had
Mhm.
patients with different orthopedic complaints that I've referred to surgery. I'm like, let's just get an opinion. Let's just see what's going on so that we know what the options are. Even if
Mhm.
they don't desire to have surgery, let's at least get the opinion of a surgeon so that
Mhm.
we kind of know, you know what I mean? Like what our options are if we get to
Yeah,
that
what's going
point,
on?
right? And
Mhm.
so the multidisciplinary team, I will refer people back to their primary care physicians if it's an issue that I
Mhm.
think requires work. I've referred a lot of patients to rheumatology. I've diagnosed a lot of rheumatologic illnesses.
Yes. Yes.
I have referred people to their OBs for hormone replacement therapy because they come to me and I'm
Mhm.
like, this is perimenopause, but they don't realize that it's perimenopause. And so I've been able
Mhm.
to identify that they're in perimenopause and direct them to someone who can provide them with hormone replacement therapy. So as
Mhm.
a both interventional pain physician and pain specialist, and kind of my approach to pain care, I will say
Mhm.
those are kind of the roles that I have played. And then of course I do procedures as well, but and
Mhm.
patient education. But those are the things that I would say I have done. I'll let you kind of speak from your perspective, Dr. Key.
Yeah, I would say everything you just said, honestly. Like I've referred people to a PMR doctor, to a pain
Yep.
specialist,
Yes.
to
Sports medicine.
um
Yep. Forgot
yeah,
that.
rheumatology, primary care
Neurology.
provider, neurology, yes, neurology when there's something that you do your nervous system testings and you're like, yeah, something feels off.
Yeah.
I
Yeah.
don't
Yeah.
want to touch you here,
Yeah.
Um I I want to address this because I think this comes up with my patients a lot. Rarely when I get to a place that I'm like, let's get some imaging done. Because a lot
Mm,
of times people have that, again, fear of like, which is one of the questions here of like, if I've been told I have a herniated disc,
right.
a lot of us walk around with actually herniated
A
discs.
lot of yep.
A
Hmm.
lot of us walk
Yeah.
around with arthritis in our spine, in
Yeah.
different levels that you have been loading and putting. And some of it is age related, but some of it is activity related and the movement pattern that you
Right.
have. But that also gets in the patient's brains that of like, okay, I have this thing going on and it's not fixable, and that itself, like that stress of that
Right.
actually causes more
Right.
issues that you can address. So
Right.
so I say like sometimes when I have patients that like, yeah, we do the neurological testings or other testings that I'm just like, okay, something does feel off, let's get like an MRI or x-ray or something that to get us more, it's a tool of giving us more information of what's going on. Another big one I would say is mental health therapists, because especially patients with, I would say, chronic pain. If the root of the cause is stress, that like anxiety, stress, depression, and then when they can't do the things that they're trying to do, that causes them also get into the cycle of
Yeah.
anxiety, depression. So I think it's a beautiful thing when we actually come together as a team. And
Totally agree.
nutrition, I would say nutrition is
Yep.
too. Like,
Yep.
what is your nutrition? Like,
I refer to
what are you
nutrition a lot
putting in
too.
your
Yep.
body? Like, our food's supposed to heal us,
Hmm.
not make our inflammation worse. A lot of
Hmm.
times it's actually is very connected. Like we don't realize how
Absolutely.
connected our body is, how connected our brain is. So I would say everything that you said, along with adding these are the people that I would send. And the goal, I guess, it goes back to the patient-centered goal. Like,
Yep.
what are we trying to help with the patient to get to that place, and how can we come as a team? Because the beauty of it is like you're a specialist in here, I'm a specialist here. You may see
Yeah.
more patients in this area, and when we come together, it's a very powerful team that can help
Yeah.
different
Absolutely.
things.
I love it.
Yeah.
And let's see, Kali Drudo, to answer your question as well. So, can PT help for things like disc injuries that most physicians may say cannot be healed, only managed? Yeah, they definitely 100% can. So, that's one of the mainstays of the protocols that I develop for my patients that do have disc injuries is physical therapy. Sometimes it's such that they're not able to tolerate it yet. And so,
Hmm.
really, what I explain to
So key.
patients is that the role of what I'm doing, whether, from a interventional standpoint, if it's
Mm-hmm.
an epidural steroid injection, because I've literally had patients come to me who they couldn't even sit. Like, they were
Mm-hmm.
flat the entire visit because of the
Mm-hmm.
disc herniation, and
Mm-hmm.
they couldn't even get to physical therapy, right? And
Mm-hmm.
so at that point, it's like, okay, let's decrease this irritation and this inflammation so that you can at least start getting to be able to engage with physical therapy. So that's where,
Mm-hmm.
I'll get started with the epidural steroid injections. I'll get started with a medication regimen so
Mm-hmm.
that they are able to engage in physical therapy. So that's one of the most important things, actually, that I talk to my patients about when there
Mm-hmm.
is a disc herniation, is to really be able to engage in physical therapy and to be able to strengthen the structures that need to be strengthened, and to give that disc a chance as much as possible to resorb back as much as possible. And I've talked about this in some other videos that I've done, is
Mm-hmm.
that the disc it takes, at least 6 months for it to resorb. And so
Mm-hmm.
for me, it's all about doing what I can to give that person the best shot. So yes, physical therapy can definitely help with disc injuries. And when it comes to that, my role is to do as much as I can to make patients functional enough to get to physical therapy so that they can do that work of getting that help for their disc injuries, for sure.
I would say one more thing added to that. I have seen, is both research proven, and I have seen it clinically myself, that
Mhm.
some of the disc you can revert it back. You can
Yeah.
push it back depending on
Yep.
how bad, like in the lumbar spine, like one of the specialties that I have is McKinsey certified, and that's mechanical. We treat a lot of mechanical low back pain with certain exercise-based
Right.
program that really scientifically and clinically proven that it
Yeah.
can help your disc be pushed
Right.
back, and you
Right.
don't need surgery. You don't need, like,
Right.
that's the first thing that a lot of patients get really worried about. Like, do I need to do surgery? Do I need to do like
Yeah.
all the other next steps? And sometimes that is a route that you have to go to. But
Right.
I always tell people, try the best to
Right.
go every conservative route. Like, I've had one patient that, like, young guy, he did a deadlift. I think he was like mid 20s, and
That's
he
tough.
was like, yes, oh my gosh, he could barely walk. And when he would walk, he only had to walk on his tippy toes because he was in so
Toes.
much pain. When he would lay down, he had to lay down his entire body. And we went through like a 6 months of physical therapy.
Yeah.
He had to get epidural
Yep.
injections. He had to get the things to get to a place that I
Right.
can like work
Right.
with him.
Right.
And he was so disappointed to the point of like, I want to go get surgery. I'm like, no, give me the time,
Oh,
work with me. And he was like, so, and we tried everything. We
yeah.
tried traction, mechanical traction. We tried exercise. We tried dry needling, and he was able to go back to normal. He was able
Oh,
to get
that's
back to running and
awesome.
walking. And it was like so encouraging to
I
see
love
that. I
that.
mean, it took a while, but like
Yeah.
it worked, you know? So
Yeah.
like it definitely can make a huge difference. And one of my things is like, another question that I get from the patients a lot is like, should I do the medication? Should I do
Right.
the injection? And they're afraid of getting that cycle of medication. And I tell people, medication is another tool,
It's a
and it
tool.
can be very beneficial
It's a
for
tool.
an acute short period of
Right.
time, you know?
Right.
So like, don't be afraid of it.
Yeah.
We don't
Yeah.
want you to get used to it,
Yeah.
but it's just a tool that can
Yeah.
help us to get to the next level that we can do
Exactly.
with the other tools that we have. They're
That's
all
right.
tools, you know?
They're all
So
tools. They're all tools in the toolbox. That's definitely my approach. It's like, they're all tools in the toolbox. This is
hmm
about helping you be well, helping you do things that you need to do. And it's wonderful, right? When we have those patients who improve with conservative care. And
hmm
sometimes patients need surgery, and there's nothing wrong with that either, and they get surgery
absolutely.
and they do better and they're able to function.
hmm
So I think, what we're both saying really is that it's really about understanding the patient, where they are, using our
hmm
expertise to get them to where they need to go, using the expertise of our colleagues to be able to make
hmm
sure that they have all the help that they need to get there. And at the end
hmm
of the day, it's about the patient's objectives and goals, right? So if the person is not making the progress that they want to make, or if their symptoms are persistent and things like that, and
hmm
they want to proceed with surgery, then I definitely don't stand in the way of that. And so I'm really big on supporting patients with kind of what their objectives are.
Yes.
So no, this is awesome. So thank you all for being on and for your comments. So if you enjoyed tonight, I do have a school community, so you can look into the in my bio, and you're going to see join the pain relief community. We do Q&As,
hmm
so you can join me there.
This is
I do.
wonderful.
Yeah, I'll be doing Q&As there.
Definitely
So
let me
definitely,
know because I
yeah,
love this. Yes.
join the community. We can go live together in there. So
I would love that.
if you guys enjoyed this, definitely join the my school community. And Dr. Keat, please tell everyone how and where they can find you.
Yes, so if you guys go to my page, Be More Mobile PT, you have the direct link that you can contact me. I offer a free consultation to just to get to know you, see what's going on, see if we can be a good match together, and then we can straight booking, or you can just go ahead and straight booking. So my number is there, my website is there, my email is there, and you can message me or DM me on Instagram or just call me directly. But I would love to help you if you I want you to know there is help there, and
Yes.
sometimes we can get so discouraged with our pain, and especially if you've been having this pain for a long time. I know firsthand what that feels like. And
Yep.
so I can, if you get anything from tonight, is that there is help and there's healing out there, and we're here to help you. So don't
Yes.
hesitate to reach out. Yes.
Yes, love it. There's help, there's hope, there's
Yes.
healing. So we're here to help. Again, feel free to reach out, join the
Thank you
school
so
community,
much.
the pain relief
Hmm.
community. Make sure to follow Be More Mobile PT,
Yes.
and reach out to Dr. Key for consultations. Okay.
Yes.
All
Thank you,
right, you
Dr. Crystal. This
guys.
was so lovely. So
Yes,
nice to
looking
talk to
forward to
you.
the next one. Have a good night. Thanks for
Thank
joining,
you. Have a good night,
everyone.
everybody.
Bye.